I just recently experienced one of my most difficult patients to date, and what we did to help him may surprise you. Recently, while working, I was called to see a patient who was having uncontrolled symptoms. When I got to their house, they had been having pain, constant nausea and vomiting, and nothing had worked. So it'd been about 2 or 3 days that they were off and on having these really bad, uncomfortable symptoms. Other nurses prior to me had tried many things to help this patient, and nothing was sticking. Now, sometimes when people have tumors blocking their small bowel, it'll be hard. They can't go to the bathroom, they feel nauseous all the time, and they'll be vomiting all the time. So it's a really hard symptom to manage, and the normal things we do to help with nausea and vomiting don't work because there's a tumor blocking their intestine. So this person was in agony for many reasons: for pain, for constant nausea and vomiting. If anyone's ever experienced that feeling, you know how awful it is. And because he was constantly nauseous and vomiting, it was really hard to give him medications. One, he could definitely not swallow anything and keep it down. And two, even the medications sublingual were not helping. They had tried IM medications, they had tried patch medications. Nothing was working. Okay, so by the time I got there, this poor guy was literally holding my hand and begging me to die. So it was heart-wrenching. It was heart-wrenching knowing that we had tried so many things and nothing was helping these poor man's symptoms. And when someone feels so sick, of course they want to die. They can't tolerate it anymore. As I was sitting there, I was thinking to myself, what else can we do? What else can we do? And it dawned on me. Do you guys know what I'm going to say? His rectum. His rectum! The rectum is an amazing place to give medications, specifically when someone is super nauseous and vomiting. So I called the doctor. I said, hey, we haven't tried this yet. We have a bunch of liquid medications here. We have a little syringe. Can I give his medications via the rectum? And she okayed it. We called the pharmacy. We made sure it was all okay. Then, of course, I had to talk to the patient. And the patient, anyone who hears this is always kind of like, oh, I don't know. Are you sure? Maybe we can try something else, right? Now, I think because he was so desperate, unfortunately, it didn't take much convincing. He was kind of like, you know what? I'll do whatever. So most hospice patients have these little syringes at their house that they use to give morphine or Haldol in their mouth sublingually. There's no needle or anything, it's just liquid. So he had multiple little syringes like that. I dedicated one for his rectum. We gave morphine for pain. We gave Haldol for nausea and vomiting, and Ativan to help relax him because he had been in agony for, multiple days. I am telling you, 20 minutes later, this man, for the first time in days, had relief. And he wasn't even sedated relief. It was like he perked up. It was like the pain was gone, he was relaxed, and the nausea and vomiting was gone. All because we gave the medication in his rectum. To me, it was like a miracle. This man finally was brought back to life. His symptoms were controlled, and we just basically kept doing that for him. His family learned how to do it so he could be comfortable, and that is how we ended up managing all of his symptoms. This man did eventually die, but he died very comfortably. So that is why I always want to educate about giving medications in the rectum. So let's talk about why it's so effective. So our rectum is rich with blood vessels. The walls of the rectum have a lot of blood vessels. So things can be absorbed quickly into the bloodstream. And the coolest part is a lot of times the medications will bypass the liver, which means it's not broken down too soon, which means it'll work more effectively and faster. So to me, it's a no-brainer. So why don't we use this more, people? I'm here to advocate for it. I'm here to educate you so you can even say something to your healthcare providers, because I think talking about giving medications in our butt, right, sounds so taboo. So, we want to avoid that. That's too private. That's too embarrassing. Maybe if people knew how effective it was, maybe we could get around that, because it will really help, and it can really help people, specifically if you are on hospice. Because a lot of times in the hospital, yes, you can get IVs, you can get a PICC line, you can give medications directly into your bloodstream easily with an IV. But on hospice, we don't do IVs. We don't do IV medication. So if that is the case, what is the most effective way? And sometimes via the rectum will be the most effective way. So education is key. Knowing this, knowing that that's an option, and knowing how well it can help. So let's talk about what symptoms we can manage rectally. Generally speaking, almost all of them. Pain, nausea and vomiting, anxiety, agitation, restlessness, seizures, and fevers. Those are the main symptoms that we deal with on hospice anyway. But a lot of times, if the traditional ways are not working, think giving medications via the rectum. It can come in suppository form, liquid form, and you guys heard me talk about this, the Macy catheter. The Macy catheter is a catheter that can go into the rectum. It swoops around, sits on your thigh, and then medications can be given via the Macy catheter. So it's also an option. Now, some hospices use the Macy catheter all the time, some don't. I like to educate about it because I think it's a great system to use. I think it's particularly beneficial to use medications via your rectum if you have extreme nausea or vomiting. When anyone is nauseous, let alone vomiting, it's hard, it's hard to keep medications down, and it's hard to take anything via your mouth because you feel so sick. I have seen anti-nausea suppositories given via the rectum work miracles. So if you're watching this and any of these things sound like you or your loved one, talk to your providers about getting medications to give via the rectum. Like I said, either suppositories or even liquid medications that can be given with a little syringe. To me, even other healthcare providers don't think of this, right? Or they don't think, oh no, that's not what we do. It can be done and it is very effective. It's not just for nausea and vomiting, but that's the first thing I always think of because it's so hard to keep things down when you are nauseous. But it can be used for pain, it can be used for seizures, it can be used for shortness of breath, really anything. At the end of the day, especially on hospice, the main goal is comfort. So don't let the tabooness of the rectum stop you from getting relief. You guys, I'm excited to announce that my journal is officially out, the Nothing to Fear journal. It's an easy how-to plan for the end of life. And it goes with my book. So if you read my book and you're thinking, now what, Julie? This is now what? The Nothing to Fear journal, an easy guide to help you plan for the end of life. If you're interested, you can get it at hospicenursejulie.com or just click the link in the description.
Oh my God! Okay, it's happening. Everybody stay calm.
What's the procedure, everyone? What's the procedure?
Stay calm!
Wait.
Everybody calm down!